Next, Dr. Sabarinath. Dr. A. Balaraj is present here. Okay, so he'll be the next speaker. Please be ready.
Good morning everyone, myself Dr. Sabarinath, MS resident from Aravind Eye Care System, Madurai. Today I am going to discuss about visual outcome in patients treated with corticosteroids for indirect traumatic optic neuropathy. Traumatic optic neuropathy is uncommon but potentially sight-threatening condition resulting from either ocular or head trauma. The incidence ranges between 0.7 to 2.5%. It can be classified as direct type when there is a direct injury to the nerve in form of avulsion or laceration. Indirect type when there is an impact to the forehead resulting in a shearing force and stress wave which propagates towards the intracanalicular portion, which can either result in axonal injury, disruption of blood supply or intraneural edema. The aim of our study is to compare the baseline visual acuity with final visual outcome in patients treated with high-dose corticosteroids and to determine the predictors of final visual outcome. It is a retrospective study conducted for a period of 6 months at Department of Neuro, Ophthalmology, Aravind Eye Care System, Madurai. 51 patients were included in this study based on sudden loss of vision with RAPD following trauma in the absence of other causes of vision loss. Those who had a contraindications for steroids, those who had a direct injury to the nerve, those patients with decreased vision due to other causes of trauma like corneal tear, hyphema, subluxated or dislocated lens and retinal detachment were excluded from this study. Coming to the results, 96% of our patients were male, 3.9 were female. Their mean age of presentation was 33.92. The most common mode of trauma was RTA, which was 78.4%, followed by fall, followed by an assault. All our patients were traveling in two-wheeler, less than 1% were wearing helmet, 9 of them were under the influence of alcohol. All our patients had unilateral involvement with 100% of them had RAPD. Based on time of presentation, 33% of our patients presented within 72 hours of trauma, 21% presented between 72 hours to 1 week. 64% of our patients had color vision defective, in 27% of patients we can't able to assess the color vision. Based on visual acuity at the time of presentation, 23% of patients had no light perception, 41% had between light perception to 3/60. 31 patients had orbital wall fractures, of which lateral wall being most common. 60% of our patients had craniofacial fractures, 25% had intracranial injuries. Coming to discussion, those who presented within 2 weeks to our center following trauma was treated with IV methylprednisolone 1 gram for 3 days, followed by oral methylprednisolone 1 milligram per kg body weight on tapering dose for 5 to 6 weeks. Those who presented after 2 weeks were treated with multivitamins. We compared the visual outcome in steroid treated group by dividing them into 3 groups. Those who presented within 72 hours were classified into group 1. Between 72 hours to 1 week were in group 2, and 1 to 2 weeks to 2 weeks were group 3. And we found that those who presented within 72 hours and between 72 hours to 1 week had better visual outcome at follow-up visit, which was found to be statistically significant. We also evaluated the factors which influences the final visual outcome. We termed them as a good visual outcome if there is more than 15 letters improvement from the baseline. And we found that out of 29 patients, only 5 patients who presented with blindness had better visual outcome at follow-up visits. Out of 18 patients with LOC, only 1 patient had better visual outcome, and none of the patients with zygomatically-maxillary complex fractures had better visual outcome. To conclude, visual outcome was better in patients who presented within 1 week of trauma and treated with high-dose corticosteroids. Mild to moderate visual impairment at the time of presentation had good prognosis. Those who presented with severe visual impairment with blindness and those with LOC, orbital and craniofacial fractures had poorer visual outcomes. These are all my references. Thank you.
So, how many of these no PL patients got some vision?
Ma'am, no ma'am. Only 1 patient improved to hand movements, ma'am. Rest of them stayed no light perception only, ma'am.
So steroid was given within patients who within 2 weeks, right?
Yes, sir.
Who presented within 2 weeks.
Yes,
After that, no steroid.
No, sir.
Okay.
So this international optic nerve trauma study is there.
Okay.
How is your study different from that?
Ma'am, they were saying either you treat with steroids or optic nerve decompression, there is not much of improvement. But in our study, we found that majority of our patients presented within 1 week, ma'am. Presented within 1 week and treated with IV methylprednisolone, they have some visual improvement, ma'am. Particularly those who had a mild and moderate visual impairment at the time of presentation, they had a significant visual improvement, ma'am.
What multivitamins were given? Any specific combination or?
So we gave methylcobalamin.
Mainly.
Yes.
Okay.